Well, welcome everyone. Again, so nice to see you. I'm Carrie DeSalle. I'm a co-project manager for the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, also known as NTAC for short. We're so excited to welcome you all to today's event titled Best Practices for Continuity of Care Before, During, and After Stabilization Services. This presentation today is being offered through NTAC, which is funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, and all content that is being shared is that of our presenters and do not necessarily represent the views of SAMHSA or the US government. A copy of today's presentation materials and handouts have also been sent out to all participants prior to the session, and a recording of today's event will also be made available. In case of any security issues that may occur, the session will immediately shut down and not resume using the same join link, and then a separate email will be sent out to all participants with some further instructions. Before we begin, I'm going to take just a couple of minutes just to share a quick overview about our center. NTAC is a multidisciplinary team, a collaboration by all of the partner organizations that you see here on your screen. And our goal is that all children, youth, young adults, and families with emotional and behavioral health needs can access treatment and services in a well-coordinated system of care. If you want to go 2 slides up. Here's just a snapshot of those we serve, from local and state agency leaders to mental health workforce, schools, youth, families, peer specialists, and many more. If you want to go to the next slide. We offer a variety of no-cost resources, such as coaching and consultation and training opportunities, such as today's event. And we are launching our very first annual System of Care Summit. It's going to be a virtual event on May 10th and 11th, with May 10th being a grantee meeting for the SAMHSA-funded System of Care grantees. And on May 11th, it's open to all children's mental health advocates, including the grantees, as well as anyone else invested in the mental health and wellness of children, youth, and families. And CEUs will also be available at no cost to you. So if you'd like to check out our website to learn more about the event, to learn more about NTAC, or to contact any of our team members, we'll drop that link into the chat box right now. And then that's pretty much my little plug for our center. And with that, I'm going to go ahead and turn it over to our friends at Stanford Sierra Youth and Families to get started.
All right. Well, welcome everyone. We're excited to join for the second part of this series. Today's topic is supporting youth and families along that crisis continuum, both before, during, and post-crisis supports. And so we'll talk about the different ways that we do that, how we elevate and listen to family and youth voice. And so I'll just give myself a brief introduction. I'm Ebony Chambers. I am Chief Family and Youth Partnership Officer at Stanford Sierra Youth and Families. I have our organization serves youth and families in the larger Northern California region. And my role specifically is to support youth and families in the elevation of their voice. I have lived experience, a mom of 4 with my oldest having navigated services as well as crisis supports. And so being a part of that system and navigating it and seeing some of the complexities that I faced, I became really passionate about ensuring that as youth and families navigated these complex systems, that they had these additional and valuable layers of support, those that have and can understand the system because they've walked through it themselves, in addition to the other team members that support youth and families. And so I am, again, passionate about that advocacy, as well as ensuring there's equity and access to for everyone that needs it. So I will pass it to my colleague, Christina.
Hi, everyone. My name is Christina Cagle. I'm the director of our Family and Youth Partnership Department here at Stanford Sierra Youth and Families. And much of what Ebony has shared, I too also have. So I have my own lived experience as a youth in being raised in a home that took in foster children and watching my youngest adoptive brother, um, who has significant mental health issues and challenges, is now incarcerated because of mental health challenges not being addressed. And I think about equity and I think about what it is to be a Black man and assumptions made. And so I'm really passionate about making sure when folks are receiving services that we're really listening and feeling for what they're saying and not always reacting in this way of armchair professors, but there's a way in which we can use both. And then in my own family, I had the pleasure of bringing in a 16-year-old who lived with us for 4 years, who changed all of our lives. And I saw how a system, child welfare, juvenile justice, impacted him while he was with us. So I am here to also share my passion for the important use of uplifting voice and choice for families. As someone who worked in the field as a professional and then transitioned into really upholding and solidifying what it is to be a family partner or a youth advocate. And with that, I will pass it to Gabran.
Hello, everyone. My name is Hibaran Mendez, and I am the Director of Quality Improvement at Stanford Sierra Youth and Families. And a little bit about my role as the quality improvement is I support within the agency with clinical practices and system development and our program evaluations. And so in my work, I really get to support the work that Christina, that Ebony, and that our whole agency does in really engaging marginalized communities, the families and youth that we serve, and elevating those youth and family voices into the practices that we deliver to make sure that they are family-led and family-informed, and that we have staff who understand those needs of our youth and families, and our practices are in alignment with those as well. And so glad to be here and to connect with everybody today.
Yes. So I so appreciate those that have already dropped their names, their roles, and where they're from in the chat. If you're just joining, please continue to share your name, your role, and also we're going to quickly review the agenda that we have for our time with you. If there are, or when you saw the description of this webinar, if there were areas that really excited you or questions that you had that you hoped would be answered during this time. We know that you have so many things, competing priorities within a day, and we're grateful that you joined us for this morning or afternoon, depending on your time zone. So we really want to make sure that it's useful and supportive to you and your time and commitment to joining this. So if there are questions or thoughts that you have that you would like to drop in the chat, please feel free to do that, so that as we are considering how we can present this information, that it's really meeting your needs. So thank you for that. So our agenda today, we are going to talk about ways that we have elevated the voices of those that we support in our community, how we go about listening through listening sessions and other strategies that we implement. We'll also talk about some of the practices for continuing to elevate families' voice, how the Youth and Peer works before, during, and post-crisis services. So lots of different ways and strategies that we take to address varying levels of support when families are in crisis. And so we'll talk about ways that we do that. And then we will introduce, Gimran will introduce the Plan, Do, Study Act. Our goal and hope is that as you step away with new learning and knowledge and strategies and have the opportunity to even share with each other, that you put a plan into action, that this is not a one and done webinar, but an opportunity for you to intentionally take away something that you can put into practice within your own organization. And so we'll hold some space for that towards the end as well. So a little bit about Stanford Sierra Youth and Families. Our mission is transforming lives by nurturing permanent connections and empowering families to solve serious challenges together so that every child can thrive. And our vision is that our communities are safe, that they have lifelong connections for all young people, and they're built and strengthened through generations of empowered families. And so our vision really speaks to wanting to see long-term self-efficacy for families so that the next generation is no longer impacted by some of the trauma and complexities that they're navigating currently. And we really are inspired by that vision to ensure that all youth and families have those strong connections, and there's been a change in their family's legacy to one that involves more health and well-being and empowerment. So we'll take some time to talk about ways that we elevate families' voices. So one of the things that's really important for us is as we consider crisis services, it's important that as services evolve, as we consider different strategies to support youth and families in our communities and individuals in our communities, that we are constantly taking a look at how to improve that and what we can do differently. And we do that by embracing and elevating voices and partnering, if not supporting families and youth in leading the process of care. So the service delivery model is really shaped by their input and their voice. And we've got some varying spaces to be able to do that. It really is important to take a multi-pronged approach when you're thinking about how services are being designed and shaped. And so in addition to crisis supports, we're leaning in, utilizing these different methods and strategies for all of our approaches, not just crisis services, but we're asking for feedback and also looking at strategy and implementation, policy, practice and procedure in these varying forms of methods. So this first one is listening sessions, and we'll share a bit in just a moment about how we go about scheduling those and what that entails. We also get feedback from families through surveys. If they've experienced a crisis, we are also doing on-call feedback surveys to find out what their needs were after a crisis, and what ways and additional ways we can provide support, and if that experience, the response system was supportive to them, and what resources they'll need after that. We also have, in addition to listening sessions, we have panels with youth and families providing and sharing feedback. Shared leadership, we'll talk about that and do a deeper dive into shared leadership. We have Resilient Youth Speak Out, which is RISO, and they're not only giving us feedback, but also a part of training some of our county child welfare workers and providing feedback to our clinical team as well. And then the on-call crisis follow-up. So in addition to surveys, there is one that is specific to the on-call crisis teams. So a little bit about our listening sessions, and I love these images because they're taken directly from our listening sessions that we held in partnership with Kaiser. And so this, the two images, the image to the left is actually some of the team members that were sharing their own experiences. And so one of the areas that we really strongly consider when we're hosting listening sessions and to support youth and families in true and authentic engagement is to ensure that as those listening sessions are being held, that those with lived experience like myself, like Christina, that are a part of the listening sessions are also starting it by sharing our own experiences to support the comfortability of youth being able to share their own experiences. when we're having them in person. And over this last couple of years, they've all been virtual because of the safety and health of others. So the image to the right is of one that was in person. And so we really want to make sure that when we're thinking about how we're going to shift and elicit feedback from others, that we have multiple methods of doing that. And so at this particular listening session, there were easels set up around the room. So in addition to youth and families being able to share experiences out loud verbally, we also want to make sure that they have an opportunity to be able to write down those ideas, that we have fun, engaging activities to get them comfortable. So currently virtually, we do icebreaker questions and just allow time for that connection so that they're comfortable and ready to share in a way that works best for them. So these are some of the questions we've utilized in our listening sessions over the last year. Again, shaping pre and post services, we're asking questions related to how caregivers are supported when challenges arise in the home. Questions like this allow us to know what additional supports do they need? What can we consider changing or shifting within our organization to provide additional support? How has the impact of COVID affected their ability to access resources? We saw a decrease in accessing resources with families, accessing child welfare services because of so many things being virtual or online, where youth and families had less access to that, as well as not having access to internets. And so through hearing this, we were able to make sure that we were sending out resources around the internet buses that were in our local areas, and the different ways that we could offer additional support to make sure that there was additional access and equity, especially for communities that didn't have it. Christina, is there any questions here that you wanted to highlight as well?
So I just wanted to say listening sessions are another great way to bring community partners in to the space with those who are being served. So we had this amazing listening session with a county social worker and probation, and we talked about crossover youth with youth that were crossover, and it was this amazing organic way of really connecting to like the humanness, right, of these positions sometimes that are seen as powerful. And we got to hear from county workers about what it is to work with a probation officer and some of the challenges and the barriers. And then we got to hear from probation about really what their intent is and some of the challenges and the barriers, but also for the kid who gets stuck in the middle. And we heard from their family members, their parents, their caregivers, who also shared like what it is to navigate both systems of care, juvenile justice or child welfare, and sometimes the competing needs that both systems have in order to advocate for the same kid, but from very, very different lenses, sometimes depending on the perspective and where and what's being elevated or in that moment for that youth. So listening sessions aren't just for those directly impacted who are receiving services, but it's another great way to bring the professionals to the table to have a conversation with the community and the community with the professionals who they're receiving services from.
I would also add, as we continue to host these and you think about how you can incorporate listening sessions in your own organization and community, especially as it relates to shifting crisis response systems, that you follow back up with those that have been a part of it and share the progress that you've made based on their feedback. That we're not simply holding and hosting that time and then not following back up to let them know the changes that and the impact that they've made to our systems as we continue to shape and ensure that crisis response really meets community need. And so that's an important piece. And the other part of those listening sessions is also making sure that families and youth that are participating are compensated for their time. So we have something called Lifeline Funds, which is an open fund that allows us to have the flexibility to utilize some of of that flexible funding towards compensation or stipends for their time. And we do that through, donors that understand how important it is. And that goes back to how we communicate with community and letting community know just how important family and youth voice is to our service delivery models, and that their voice is critical, and that we shouldn't be asking them for their feedback without identifying a stipend model to ensure they are compensated for it. And so we have Hebron here with us, and we're so excited QI is in partnership with us, because when we think about families and youth shaping service delivery models, we have to know what the information tells us. And our QI team is able to pull that data together. They're able to look at surveys and find trends. They're able to look at the demographics and see where the disparities and gaps are to improve services for youth and families, especially when there is disparities that exist in crisis response and how crisis response is accessed, especially by communities of color, and what that looks like. So, just from my own experience as a Black woman and navigating crisis response with my own kid, when she was a kid, she was now a 29-year-old adult, but when she was younger, there were just some certain things that I would not do as a Black mom. I was not calling 911 to receive support when she was particularly activated or triggered and in a crisis space. That would have caused potential community harm, or further harm to our own families. There was a safety risk that we had to look at. And so we are really invested in finding what works for families and creating crisis response plans individually. So there's no cookie cutter approach to how we're doing that. It's set individually by the families, but the information tells a story. And so this was from one of the listening sessions, as well as one of the questions that was asked, and that's how comfortable are you in sharing your experiences with mental health or trauma with others in a group setting? Because this also informs, what does group supports look like? And how many might be interested in joining, and if there's less comfort, you see there's 24% saying nope, not comfortable at all. Well, we know then what the engagement and success rate may be if we're holding groups with youth, and in regards to what their comfort levels are in sharing. So we really want to make sure that as we're thinking about what information we're gathering, how that's going to shape what kind of services and supports we would offer. And this goes for pre-crisis services. So we talked about this before, during, and after. This is all information we can gather to inform how we're going to support families during and after. One of our favorite groups, if I can say, is definitely the opportunity to have a platform for shared leadership. I'll start off sharing just a little bit about how it began, and you'll see some of the information on the slides, and then I'll let Christina talk about where they're at now. But shared leadership started in 2015 with our organization, so about 7 years ago. We invited families for what we called a coffee talk. It was under shared leadership and letting them know how important their voice was. We held a number of coffee talks over the course of a few months, just inviting parents and caregivers to come in, share their experiences, and share what they hope to see in the organization, what might look differently, how might they inform ways that we can improve our supports and our services. And so that was our very first flyer. You'll see it says Stanford Youth Solutions, because that's our previous name. We've since merged, and we're now Stanford Sierra Youth and Families, but that was our original informational flyer that went out. right away, our families were engaged. They really wanted to be a part of providing more direction and having a voice in their services. And so shared leadership is still comprised of families who are currently receiving services, who are post services, and then even invested community members. And sometimes those are friends of those that are in shared leadership and want to be a part of this and share feedback as well. And so the image to the left is a snapshot of their first newsletter. They provided in that, it was probably a 5-page document. That's just the very first page with some poems, but they have recipes and just ways that they can connect, sharing information about the upcoming support groups, and giving tips on free and upcoming activities that were being held in the community. And then we were able to take that and share that out with staff so that they can send that to all of the families that we serve in our organization. I'll turn it over to Christina.
So shared leadership has really gotten some of the initiatives that this group has come up with and ideas is that it's really grown. It's the same families, not the same families because families change and evolve to who's receiving services and how they get involved in our shared leadership program. But right now we're really focusing on how they are helping our organization walk through our COA accreditation. So Council on Accreditation, that process, they're helping us review policy and procedures. Oftentimes things will come out of our executive team meetings that the executive team feels like, hey, we need to bring this to shared leadership and get their thoughts and perspectives on. And so we will bring documents or ideas or the way in which a process may shift or change to shared leadership to receive their feedback on how it could be received as, staff are going to be asking or shifting and changing practices. We also talk about support group topics. Oftentimes this group will come together and say, I really feel like our group can work on better communication. And so recently they just did a communication training on how they can be effective in working with their support services, but also how they can continue to make change within the systems they're in outside of our organization. So showing up to school meetings, running PTA groups, running even shared leadership groups at a school level. So it's really about how they're making change within our organization, but also gathering those skills so that they can continue to make change in the community that they're connected to. I think another piece is they often help us and want to do fun things like around the holidays, they hold space for families to gather extra items for Easter baskets or Christmas stockings. Some of our families are really connected to other organizations and churches, and those churches often want to help out. And so shared leadership has created a space in which they show up and kind of show out for the families who are impacted by services with us, and they send out word searches and hold coloring contests, but it's a way to make sure that other families who may not necessarily feel they want to get involved, but will have this connection to folks where it feels less heavy on like what the services are, but connected to the agency in a fun way.
Yeah. And what does this mean for crisis services? The connections and community that's being built, what's being sent out, the resources that are being shared are family to family. And so when you think about family to family connection, when there are times when there are emergency services, crisis response needs, we find that our families actually are the ones supporting each other in that. We held a shared leadership, and then the next couple of days later, we had a support group, and there was individuals there that were normally a part of our group and always present that were not. And we weren't even aware that there was something that had happened with the family because they had leaned into their shared leadership and support group comrades. And so they and that's that community building that's so necessary when thinking about crisis response, because oftentimes a lot of the families that we're supporting and supporting with navigation feel very isolated and alone. I know from my own lived experience when I was navigating these very complex systems with my daughter, there wasn't anyone else in my family that was navigating those same complex issues. And I always share, it wasn't exactly like water cooler conversation. I didn't go to work and someone says, "How was your weekend?" "Oh, my daughter took off and I'm worried about her cutting and I'm worried about, fill in the blank with all of these urgent needs that were coming up for her." But there was community by having those peers walking alongside me and that could understand. And so they were able to lean on each other and share with us in the group, "Oh, this came up for them." And we all, came by their home and checked in on them. And so it was really great. That's our goal. We want to work ourselves out of this these roles in our families' lives and have them leaning more on informal supports. And sometimes that community is gained through these shared leadership and support group models. And so we encourage that as often as possible when it comes to crisis responses, building the community within.
I also want to share that I've seen families who've struggled with their own addiction. And when they show up to shared leadership, someone else may be in their process of recovery. And it has been an amazing transformative process that I've seen folks partner with other families who have similar backgrounds. And like Ebony says, creating a community so that they can solve challenges together and also feel like, one day when services end, they know how to manage crisis and they know how to get the resources they need.
Absolutely. All right. Our crisis intervention for families is something we have really excited about putting into place. And that's because our staff and our resource parents that are a part of our organization walk through an extensive amount of crisis support training. We utilize the TCI model, the Therapeutic Crisis Intervention Model, through Cornell University. And so our families and also need that same training and support. And so we were able to, look at what's currently out there in the community that can support youth and families. We found that a lot of the language in a lot of the current curriculums were not family friendly. They didn't, they were not in family friendly language, and oftentimes could feel very dismissive as someone that was kind of navigating this with their own young person. And so we took a look at modules that could support families before, during, and after crisis, and we named that Crisis Intervention for Families. So families have the opportunity to access these modules either one-on-one with their parent partner or in a group setting. And what you see to the left of this list of different, this is not the full list. These are just a few that we added to highlight. But what we do, which really helps and elicits families, youth, and families' voice, is give them the menu of different modules if we're working with them one-on-one. So we meet the families where they're at and ask them, where do you want to start? Here are the different modules. Here's how long it will take us to kind of work through these modules together. And then allow that as an opportunity to coach and develop a caregiver's skills when managing crisis situations with their young person. So an example of it, you see the first one is the stress model of crisis. We're talking with them about what are baseline behaviors, what are triggers, what does it look like when they're fully escalated and in crisis, and then how do we support through recovery and back to baseline. Adults as role models, really talking through what does it look like when you're stressed, how do you support yourself, and how do you model that for the young folks that are in your in your care, and so how can we be proactive in our own self-care and our own recovery so that we're modeling that for our young people that we're caring for. Other topics like awareness of your environment. What is there that might be dangerous or potentially elicit a crisis situation or be a trigger? How can caregivers be aware of their situations? How do they deal with their own anger? What am I feeling now? When my own, I'll speak from my own experience. Maybe it's just me, but when my own kid was having her challenges, I was angry too. There were things I wanted to see differently for her, and it was really frustrating when that was not happening. And so was it really important for me to also have to reflect and manage my own feelings that were coming up with around grief and loss, around frustration, and be able to think about my own stress model of crisis, because it's not just the youth that's thrown into crisis, the entire family unit is as well. And so lots of other topics you'll see here, but we do the exploration with the caregivers around what are the areas of interest for you? Where would you like to start? We're happy to cover all of them, but we really want to make sure that it's individualized to meet the youth and families' needs. And so crisis intervention for families is one strategy to be able to do that. In addition to the one-on-one, as I shared, there is also the group model where monthly they're able to go through a different module. And this allows, again, for that group learning, for them to share experiences, for them to talk through with each other what they had recently. We had a group where they were talking about dealing with their own anger. One of the young youth in the mom's family had exchanged her toothpaste with another with another ingredient. So he had emptied her toothpaste and added something else in there, and immediately as she's brushing her teeth, she was so angry. And the amount of support, right? This is when we think everybody defines their own a crisis and what crisis was. This was a crisis for her, right? Like, I don't trust my child now. They're changing my toothpaste out. What else could they change? My health can be at risk. And all of the other caregivers in the space jumped in and shared their own experiences of lack of trust in the home and what that looks like. And so that group space was also very helpful and supportive to our caregivers in dealing with how they have navigated through crisis themselves and sharing tips and strategies to do that. Christina, do you want to share this or you want me to keep going?
Sure, I can jump in here. Post-crisis support. So relapse prevention planning this is always an amazing conversation to have with families to talk about before and even after a crisis of, okay, what skills did we learn from that situation, or what skills have you learned from other crises that you've experienced in your family? Relapse, it doesn't necessarily mean substance use. It can mean the behaviors that we engage in when we're talking about crisis. Something that I always tell our families when we're talking to them about crisis is literally when we've come to the end of ourselves. We've tried all of the skills that we have in our toolbox, and we are really looking for someone else to jump in and support us and show us a different way, because we tend to be a little bit more malleable when we're looking at, like, how do I do this different? And so post-crisis support and this relapse prevention plan gives us that opportunity and ways for families to really reflect back and to think about, how do I do this different? And what things showed me that there was about to be an issue or a challenge? What things told me that he was or she was or they were triggered? And how can I recognize it in the beginning instead of also continuing with a power struggle or getting involved in a way that really activated my kid more or activated myself more? And so a relapse prevention plan is a really great conversation to have anytime we're talking about post-crisis support, but also bringing some awareness before you even have a crisis as the service provider with them, but reflection, right, of what crisis has looked like that's brought them into services in the first place.
Agreed. And I think when you know, even for myself as a caregiver navigating crisis response, there was something about really wanting, when I started services and supports, for everything to be perfect when services ended. But, you know, my kid was no longer going to be, you know, experiencing high amounts of anxiety and depression, and that she was going to, you know, be using all of her coping strategies all of the time, and we would never have to come back to the topics that were challenging for our family before. What the relapse prevention plan did for our family really normalized that some of the challenges that we experience were going to pop back up. Because we were human, and that we could expect it, and so it was really important to be able to, you know, talk through what did we learn, when it comes up, what might happen again. And so even as we navigate, you know, anxiety and depression now, we know what the tools are. So if these things come back up, we're able to come back around to it and address it in a helpful way, because relapse prevention has been discussed from the very beginning. And so as families, this is not just a great transition tool as you're transitioning out, but a good tool to introduce at any time during service delivery, to ensure that we're really starting to normalize that it doesn't mean failure. It just means we are human, and we're going to get back on track. And here's the ways that we'll support each other in doing that. I'm actually going to stop sharing screen for just a moment before we move into the next section, which is the PDSA, because one of the things that I think is extremely helpful is also sharing in community with each other. So we just shared a number of different strategies that we have within our organization around supporting pre, post, and during. We didn't talk a lot about our peer supports because we talked about that in the first part of the series. But for those that are this is their first time joining, we have about 35 peers that partner with a part of different teams, wrap around outpatient mental health, child welfare co-located systems. We have a youth advocates that support youth that are at risk of sexual exploitation. And so our peers are partnered in all of our programs to walk alongside youth and families through not just crisis situations, but through engagement, in planning, implementation, and transition, which is a lot of what we shared in our first part of the series. However, I know that there are a number of you who are also partnering with families and providing supports in response to crisis. And so just wanting to hold space to see if there's anyone that wants to elevate or share any strategies that they think is important for all of us that are here learning together on the call might want to know. So we'll just see if there anyone that's implementing something that's different than what we have that may be particularly useful as a resource or knowledge for others to hear from. Don't all jump at once. And feel free to use the chat as well if you've got some strategies that you think are helpful for youth and family engagement. We really want this to be a learning community. And so we know we find that best when you're not just hearing from us, but hearing from others within the group. And welcome, Patty. Great to hear, great to have you here. And I recognize, even looking at the chat, just how many peers are on the call. And so it's exciting to see that we have an opportunity for peers to be involved in crisis response services. And so we'll keep going. If there is anything that you can think of that you would like to add to how you impact youth and families in crisis response, please feel free to share and let us know.
So there's a couple of things that were in the chat. So Kevin Campbell's connection tools, yes, we also utilize those tools as well. Family seeing and not family finding. And so really, how do we see families and how do we make sure that they're fully and wholeheartedly connected to treatment teams, especially for our kids who aren't necessarily in the same home as their bio family. But how can we make sure that those connections are maintained and honored? Another strategy that was written in the chat was opportunities for parents and youth to learn in the same room. That is critical, right? Like, I think that it's amazing when we can have youth and parents and professionals all sitting in the same space and learning together and sharing together, which is some of the strategies we've shared here.
Yes, we did not share about our Empowerment Training Center, but that is an opportunity that we hold monthly learning for not just staff, but youth and families to all have an opportunity to learn together, new practices, new skills, bounce ideas off of each other. And so we hold them at a minimum monthly, and we make that free to the community so that, again, when we're talking about equity and access, there's no barriers to being able to do that, and anyone can join in from any location. And so because those are held virtually, and we'll continue to do that even after we find ourselves kind of coming back in person, so that there is opportunities for those learnings from each other. So thank you for sharing those examples. All right, and with that, I will turn it over to Kibran.
All right. So we're going to talk about a process that we use, the Plan, Do, Study, Act. And there's a formal process and we use as a QI tool to kind of developing and testing change. But what I'll also share with you that a lot of the times this is done in a very natural process automatically within meetings, within check-ins, within discussions. So let's go ahead and talk a little bit about this. All right, thank you, Ebony. So our PDSA, Plan, Do, Study, Act, is really a 4-stage problem-solving model. And really it is a process for testing change. And so as we're talking about the best clinical practices or the best ways to really support during stabilization and crisis services, we have a lot of opportunity to grow and learn from these experiences that our youth and family have, and then developing the best systems and practices that really are family-led, family-driven, and support those that we're serving. And so this is a really great model just to kind of help you say, are we doing everything that we're supposed to make change? How do we know that we're making change? What data are we getting back that tells us that we've made positive change? And then from here, where do we go on? Do we have to make another update because we learned something new that we didn't hypothesize before? Or do we start standardizing this process from a pilot project that we did moving forward? So using that PDSA process, it will help you understanding what are you trying to accomplish. It'll help you understand how will you know that change and improvement has been made. And then in the end, you'll be able to answer what changes can we make that will result in an improvement overall. So one of the ways that we naturally do PDSAs is through what we call quality improvement consultations. And so within the quality improvement department, we consult with every program and department to be able to check in, how are things going within your systems, within your practices, any feedback that are coming up from youth and family, from staff about your practices, and what are you hearing? So sometimes naturally our teams don't know that we're doing a PDSA, but we're all in consultation having these questions that result in planning. So we got feedback to say that, families don't use their safety plans in crisis. And we are realizing that maybe our safety plan isn't the most effective method for people to be able to gather information in the moment. And so from there, we say, how do you know that? What have you heard from families? What have they stated? How often does this happen for them? And so this is a great process to kind of support creating a good investigative study within your agency to see, are our practices great and how do we know that they're great? Because a lot of times what we run on is, this is what we've always done. And what we know is that what we've always done isn't always what's the best format to use moving forward. We've always known that. COVID highlighted that even more, that a lot of our practices needed to shift and change and adapt, and that we always have to move forward, and new things will impact the way that we serve those youth and families now. So the QI consultations are a formal way that we do it, but what I'll also share with you all is that you don't have to be in the quality improvement department or trained in research to be able to kind of engage in these conversations. You're going to receive a Plan, Do, Study, Act tool that will give you some guiding questions that support you going through this process yourself, but it's used by any staff, direct care staff, our leadership teams and program. You don't have to have a research background. Again, some of the methods that we've talked and shared today are informal data points that we kind of collect as well to kind of influence the work that we do. Let's see. Can I get the next slide? Awesome. So we'll be giving you a PDSA worksheet as a guiding tool and the support to kind of evaluate different changes that you might be looking at as you think about pre, post, and during stabilization services and crisis work. But some of the considerations that's helpful to do is, who are the team members that you identify that will be supporting and reviewing any change or any practices evaluation within your agency? Is that your leadership team? We've talked about shared leadership as an example. Are there families and youth that are part of those discussions? Are there direct care staff that also get to provide their feedback? And who is in this committee to kind of check in, evaluate the needs, and provide monitoring as changes occurring throughout your process? This is also a really great place, is that we know that when we ask youth and families for feedback and their experiences, if we never follow up with a change or a practice improvement or a confirmation about why we're going to keep doing things the way that we do, we know that youth and families won't give us feedback in the future, because they go, well, what did you do with that? I don't even know why you asked me all these questions, because I didn't see anything change. I'm still experiencing the same thing over and over. So having this committee really supports that accountability process to say, how are we messaging this back to people? What are our findings? How are we making process changes moving forward? And how do we improve practices to serve the family and the youth that we serve? So having that committee is going to be really helpful to kind of move processes forward. Again, it also makes it a good shared leadership process with everybody within your agency. The PDSA also has different sections to kind of give you like the next step. So you might kind of first start today and say, what do we need to examine within our agency? What are some of the areas that are considered an issue, a concern, or a practice that might be outdated? How do we know what's outdated? How have we heard from youth and families that it's a practice that doesn't serve them best, or has been clunky, or has been ineffective? And so you'll start with kind of developing this is what I think we need to work on, and this is the information that we have. You might also say, I don't know. I've never asked families if our process is the best and most supportive process. I've never examined our disengagement rates after a crisis. I don't know kind of that information. And so your plan might be right now, we don't know if our methods are effective, and we need to kind of pull families to be able to get family voice and choice about the services that we're providing. That might be your level 1 first step, Plan, Do, Study, Act. And then from there, you'll go through the process to say, we've gotten information, we've gotten feedback. Now that we've gotten feedback, now what will be my next step? Our safety plans aren't the most effective method for families to use. So our plan is we need to update our safety plans, and you'll do a repeat of a PDSA and go from there. Next slide, 70. Awesome. So as I was talking about, a Plan, Do, Study, Act is very cyclical. And so again, you're not going to just fill out this form and say, we're done, we've moved on, it's over. But your evaluation committee team will be reviewing the process over and over to say, great, what do we learn from this experiment? What do we learn from this one change that we made? We learned that we need more information. We need more data elements. And when I say data elements, they might be things that are already in your electronic health records. It might be elements that you say, we don't actually track that at all. Can we add that in our electronic health record as a checkbox to indicate these crisis services that are happening, to see how many crisis incidents occur in a month, and what are the frequency of those specific types of incidents that occur? And what's the follow-up plan? How have we been attending to them? What's the length of an incident that was reported and the date of the first session after that incident? Is that meeting the needs of our youth and families overall? So you might have to realize, we need to add data elements to our electronic health record. As we shared, we've done listening sessions, but another thing that our agency does is family panels. So we have targeted family panels quarterly within our agency where we bring youth and families from who are currently in services from all of our different types of programs. And we ask them questions about how their experience in services are. How was their engagement into services? How are they comfortable using crisis services? What is their feedback? What are opportunities that we have? And from those listening sessions, we get a lot of great themes and data points on how we can make improvements. And so that might be a data point that is asking youth and families in a targeted location feedback. As Ebony and Christina were sharing, we also have professionals that attend those listening sessions and those family panels. So we have our county behavioral health partners, our probation teams, our child welfare teams that also are invited to hear the impacts of service delivery, but also sometimes those teaming processes that we have a lot of time in our wraparound or outpatient teams that we get feedback on how probation services or child welfare services are doing, or how things are maybe disconnected, or how certain elements made kind of an impact in the family's ability to have reunification or success. So having kind of those panels is a really great way to get data out of those opportunities. As an evaluations team, we've been adapting ourselves to support programs in creating evaluation reports from even some of these listening sessions and family panels. So we take those family panels, and we're having one coming up real soon, and we're recording it through our Teams platform, and Teams will automatically transcribe it for the data evaluation team in the background. And what we're going to do is we're going to take all those things that were shared from families and start to theme them out and do a qualitative study and say, how often did this theme come up for the families that we're sharing in the panel? And what was the biggest theme that showed up overall? And then from there, we're going to make an evaluation report. We have an agency impact report, and we're going to have a section called Family and Youth Voice, where we're going to say from our panels, these are the sections of information that we have for guidance, for suggestions, for opportunities to kind of grow. And then from there, it turns into examining it with programs in our family youth partnership to say, what are we going to improve in our practices from here? And what are we going to share back with families that we took back from those panels to say, this is how your impact has created change within our service delivery model. So just really great ways on how we think about using the PDSA to really inform practices, but also how a Plan, Do, Study, Act is a process in what a lot of us are already wanting to do, which is create change, positive impact for the youth and families we serve, and make those positive outcomes in our service delivery model. Next slide. So as we start talking about this PDSA, you have it in the chat as a tool for you to review. We have inside of that PDSA, we've added elements to say, how do you ensure that family and youth voice has been involved in the process? As we've been talking again about making any good clinical practice or best practice change, we want to make sure that the family and youth voice is at the center of that conversation and is being influenced with the decisions that we make and is being discussed with them through the different methods that you've heard today. And so your PDSA will have elements to say, ensuring that you're asking and checking in with youth and families about the process, and that it's not just professionals at the table. And so what we want you to start thinking about is what are those opportunities and areas within your agency, within your work on what you're doing? Are there methods that you've been utilizing similar to the ones that we've shared where you're asking youth and families for feedback? Are you making those into themes? Are you then turning it into actionable changes and opportunities for redevelopment? And if you are there enhancements that you still see that we could do moving forward? And that might be something that you'll use your PDSA model to kind of move through. If you sat here and said, oh, wow, these are things I've never thought about doing within our agency, or we haven't really checked in with family and youth about their experiences, this might be an opportunity to say, our first PDSA is how do we engage more youth and families in the service delivery model that we've been doing? How do we engage them in conversations about post-crisis services? So other examples of things that we've done in the past PDSA versions is we were wondering how families felt supported during an on-call crisis situation, calling our staff after hours. We have an on-call system. And so we created with Family Youth Partnership an on-call system where they would do a survey, call a family and ask them on the phone the next day, how was your experience with services? Did you access your safety plan? From what were the challenges to accessing your safety plan? What were the, how did you feel supported on the phone call? How did you feel supported by your team the next day? And from that, it created a feedback loop to our on-call committee to say, these are the feedback that we're getting from youth and families about their experiences. And what are the updates that we need to create to the on-call system or to our practices overall? So different systems like that. We've also recently, as another PDSA, we incorporated well-being and satisfaction surveys. So we're asking families 1 month after they've discharged from services, we're doing phone call check-ins with them from our evaluations team to ask them a series of survey questions to say, how are they doing functioning in the home, in the school, in different locations with community engagement, that really tell us how are they functioning after they discharge. What was your discharge process? Did you feel supported? Are you still able to use the skills that you learned in sessions from the work that you did in services? Another project that we're in PDSA format to influence best practices is we're updating our safety planning process. We learned from talking about that relapse prevention plan that there's an opportunity to convert our relapse prevention plan and our safety plan process a little bit more robustly. And so we're actually borrowing from high fidelity wraparound, the crisis plan or the behavior support plan that has a series of interventions from that crisis model in different stages. And we're integrating it into our safety plan to support staff having a list of interventions to be able to create meaningful interventions for different behaviors and be able to kind of talk about it. What are the triggers? What are some of the cues that come up? And what are the interventions that you could utilize? And what will that look like for your family to create more robust safety plans that are used? And we're actually asking staff to not just update safety plans whenever a crisis comes up, but do them more often, like every 3 to 6 months when new interventions are provided in treatment services, as a great way for them to kind of ensure that the safety plan is also a prevention plan as we review those new interventions that have been learned throughout the process. So as you start thinking about all these ideas, all these changes, you see that I'm giving you like PDSA after PDSA. You're like, that's a lot. Where do we start from here? Pick one spot and do what we call your PDSA 1.0. Where do you start today? Where are you at right now? And then use your committee to start checking in and reviewing how it's going. What do we need additionally? What are the constraints that we're having? What are the challenges and what are the opportunities for us to move forward with the next step? And then again, you might do your PDSA cycle number 2 after that process ends. And so I think this is your call to action. As you've learned the process of a PDSA, or at least this lifestyle through the worksheet that you have, as well as a nice guiding tool. And as you heard all the good practices that were shared from the team, as well as how do you take some of those practices, or how do you examine what the practices are for our agency, and how do we start this process for ourselves? Next slide. So we're going to go ahead, and I know we're going to do a PDSA breakout where we want you to learn from each other and start thinking about all the things that you heard today, all the things that we've examined, and you start taking a look at the PDSA. I want you to learn from each other because, again, this is the best time where you get to share from what I heard today. This is what stuck out to me as something our agency has been having an area of focus that we've heard from families that we've been wanting to target. Or I actually heard another example from somebody else today that I didn't even think about. That is something that we've also been experiencing together. So that way you in this breakout group can start saying, where do we think that our plan is for moving forward? Where do we want to start focusing on it? You might also share with each other, what are examples of ways that you've collected data, formally or informally? What have you learned from your listening sessions, from your panels? What are the ways you might recruit individuals for your listening sessions or panels? So that way we can all learn from each other and talk about it. And then from there, start thinking about who are the people that you might start recruiting for your committee, for your PDSA committee, and go from there. So I don't know, Ebony, how long are we going to put individuals in a group for?
We'll do about, time is it? We'll pause for any questions, and you've got a couple of handouts in the chat. It's the PDSA, and then we also have added the relapse prevention plan. So we'll take about 12 minutes in the breakout groups to be able to think about. We shared a few different strategies, the listening sessions, training, so crisis intervention for youth and families, so training and supports, peer supports as a strategy, crisis on call follow-ups, relapse prevention plans, youth leadership. So lots of different ones. You may have your own that you've thought about that Hebra just shared. So that is what you can potentially include in your PDSA, is picking one strategy that you would like to implement, what you might need to do that. And so we want to pause before we do that to see if there's any questions on anything that we've shared so far, or anything you'd like to learn more about that we've shared before doing that. So we'll stop sharing now and just hold space before we move into the breakouts. You've got the handouts and resources, but are there any questions? Or again, holding the floor if there's any strategies that you are utilizing that you want to share that may be of interest for someone else that they might want to put into their own PDSA. And, okay, thank you, Patty. And I think one of the other areas that I think it's important to highlight as well is that we make these changes by documenting and following up to see how they worked. That's how we know we're making a real impact with youth and families. And so it does take a very intentional practice for us to be able to do that, and requires us to have opportunities to follow up to ensure that the implementation works and is having the best impact for families that are experiencing crisis. So with that, if there are no questions, we'll go ahead and get the breakouts there together. If there's any challenges with downloading the PDSA worksheet, please let us know. But your goal is to pick a strategy and begin to fill in the blanks on the Word. It's a Word doc, so it's a fillable document that you can utilize to begin structuring your PDSA. And then when we come back, we'll just have an opportunity to report out and share what your takeaways are, what you may be planning to implement within your own organization and within your own community to elicit family voice and ensure that crisis response systems are more family and youth engaged. All right, welcome back, everyone. Hello, everyone. Glad to see everyone back. And so hopefully there was a good dialogue. in your breakout spaces around what next steps you're hoping to take. And so this is just open forum for us to be able to share with one another what you might put down or might be putting down or have put down in your PDSA, what was elevated in your breakout rooms. So if the groups would like to share what came up for you and maybe one strategy you're considering implementing.
I just want to say something that our group and some of us came in really late, so we were just kind of like winging it. But natural supports and including a family's natural supports in their plan so that once a crisis worker is gone, they still have a support system to lean on.
Absolutely. That is critical. And one of the things that as peer supports, we work with families to identify who are their natural supports. It's a part of the transitional readiness scale that we shared during the last session is how families can scale themselves on where their natural supports are, and then what can we as peer supports do to help grow that so it's strengthened. And we also realize that sometimes based on the family's situation, some of those natural connections have been lost over time. And so if there's opportunity to either rebuild it or help them build new connections through the support groups and shared leadership, we work to do that as well. But that's a great strategy. And so one of the things, excuse me, and Hebron may be able to weigh in on this around the PDSA, is being able to put in how many natural supports would you like to increase for each family member, knowing that's one thing we definitely know, natural supports are a critical part of the family success. That helps them to lean more on their natural support system instead of a lot of the formal supports that will oftentimes not always be available like natural supports are. And so, the PDSA could include identifying how many natural supports you'd like to increase in that family's unit, when you'd like to do it by, how you're going to monitor it, and then what was the outcome by keeping a close eye on that. Brian, I don't know if you want to add anything to it.
Yeah, I was going to say, even kind of what is, as an agency, if it hasn't been a process before, in asking what your natural supports are, who those emotional support individuals could be that you could connect with. It might be even saying, implementing a new practice that says, we will now ask families in our intake, in our assessment, what their natural support, who their natural supports are, who they are, that they could be added into their safety plan. So we do a safety plan on the first intake appointment, and that's a natural place where we ask, who are emotional natural supports? These could be, I know when I got trained with Ebony at the very beginning, one of the things was we talked about, if you are in crisis, if your car has a flat, who do you call? Yeah, besides calling AAA, when you're waiting for AAA, who do you call next, right? And who are the list of people that might be providing emotional support? Your aunt in New York can't fix your tire, but could be somebody who's going to provide stability and support for you. So creating that at the beginning. And if there are not a lot of people or no one is there, that becomes part of your treatment planning process or your intervention work that you do. And then when you say, great, what is our next place where we would ask about natural supports moving forward? Is it every time we update a safety plan? Is it every 3 months when we have another assessment? Is it in child and family team meetings once a month? So that might even be part of your PDSA, is creating a practice. Where is our practice of asking about natural supports? How often do we do that? And how do we ensure it's weaved into the work that we already do? So yeah, that could be, again, that place to add that system practice as well. So great idea.
We also talked about, how do you proceduralize that? Because a lot of times I think we talked about a little guy who was on a baseball team, and his hero in life was his baseball coach. And so he had trauma, he had been struggling. And so what mom and dad did was ask him, what do you think Coach Scott would have you do right now? Or what do you think Coach Scott would say right now? And then periodically Coach Scott would call him and say, hey, I'm really proud of you. And I know one time Coach Scott was the one who was able to assist him in de-escalating when things were getting out of hand at home. but being able to proceduralize this, and I think when professionals become involved, it's, I think as a family, I think your natural response is to call the professionals. And a lot of times the professional is maybe not who is going to be able to help the child most effectively. I mean, that sounds sort of silly, but my guess is that child would listen to Coach Scott before he would listen to a crisis worker. But it's how to put that in place and to really proceduralize it, and maybe have the child be able to say, hey, is it okay if I call Coach Scott? Or maybe have the coach call the child once a week, or even send a text and say, hey, I'm thinking about you today. How are you doing today? It's something that's so simple, but when a child, in their mind has a superhero, right there for them, that is a very powerful motivator for a child.
Wow, that's really great. I love that idea. And again, I think about that as you engage in natural supports, emotional supports, mentors. Who are people that are a mentor and inspire you? They don't have to be, again, there's a coach that you have access to, which is great, but who are, again, Christina has Jason Momoa in the background of her office. And so if that's your superhero, what would they do in this situation? So what would mentor do could be part of your natural support kind of inspiration as well. And the reference throughout the journey of interventions, and then who embodies that mentorship as well. Is there a teacher that also has that same style that could be connected? So I love everything about that idea about, again, creating that as a natural support discussion, emotional support, mentor individuals who embodies this kind of skill or work that you do, as another great way to say, and we ask these set of questions when we talk about natural supports, or when we talk about safety planning, or we talk about pre, post, during crisis. So thank you, Christine. That was really grateful. That was a really great idea.
I was also thinking about when she said proceduralizing, thinking about a training for staff on how to ask about natural supports, right? That could be a part of a PDSA of what are the types of questions we ask? What are natural supports? How can we have families think creatively about that? How can staff lead conversations? So what would a training look like for folks working in the field, so that they can gain those skills to ask naturally about natural supports, and it's not dropping off a safety plan or a crisis plan or a relapse prevention plan.
Agreed. What else came up in the groups? What were some of the other strategies that could be tested out? Any others? I know one we didn't share, and just looking at the time, I guess we're gonna be mindful of that as well, is also that when you're first starting to meet with your community around crisis, most families may not necessarily know how it comes up for them or when crisis happens. And one of the ways to do that is by having domain cards. So the domain cards really kind of identify different areas in a family's life. We have peers that also are housing navigators. And so housing is a domain, oftentimes can be really disruptive to the family's well-being if it's at risk. And so by pulling out the domain cards and giving a visual to families of housing, safety, emotional support, natural supports, you can explore with them what areas are going well for you to really help identify and build on their strengths, but then also what areas may be challenging for you to help identify and advance what might come up as a crisis for the families. So if a family says, yeah, in about 2 to 3 weeks, I may be losing my apartment or my home, that's one of the areas we can do some pre-crisis planning in advance for, and make sure that they're linked to the right resources. And so that's another method or strategy that can be tested to see how does that work within your own organization, and do you have a better response from families because you're pre-identifying what might come up and planning for that in your safety planning.
Okay, thank you so much. Thank you all for attending today. A huge thank you to our presenters from Stanford Sierra Youth and Families. Their team is providing a third session in this learning series for us on May 4th, a diversity, equity, inclusion training focused on health equity within the crisis continuum of care. So please look out for those details and links to registration. For all of our upcoming events and to register for our 2-day virtual summit, please visit our website, ntacmentalhealth.org. Feel free to reach out to our team anytime if you have questions or need support. And just again, thank you for your time, for your participation today, and hope you all have a great rest of your day.